I'm live. Good morning, everybody, and good afternoon. This is Suburban Prepper live for our 7 p.m. show, and we're going to be kicking off right now. I hope everybody can see me, hear me pretty good. I got the mic going here. I'm going to do a self mic check here in a second. I'm live, and I hear myself talking. Good morning, everybody. And good afternoon. This is Suburban Prepper live for. So we're good to go. Got to do that self high five.
I have a large language model, an AI.
Or 7 p.m. And I got to turn this off. And we're going to be kicking off. There we go. Always something technical with me. All right, all right. I got a show. I plan my shows out a week ahead of time. Ideas that I get inspired from work, I think are important to talk about. I have some tech I want to go over, and I want to go over some medical. And we shall get started. All right. I will start up with my prepper updates. Of course, I got my garden going. First time of the year I could get the weeds and get some stuff out of them. Okay, now the weeds that I have are called land quarters, and they say they're edible. I've seen videos of people eating them. I am not going to eat them. I pull them. I thank them for their service, and I put them in my composting bin. I need to do a prepper garden video because my zucchini is ready to transplant. All my plants have made it. It's a miracle. But I'm going to have a lot of zucchini this year. The sweet potatoes and the purple potatoes that I planted, all the purple potatoes have taken off. Most of the sweet potatoes are going pretty good. Couple I'm not quite sure, and that's okay. If there's an opening, I'm sure it'll get filled up. I had to de-weed the eggplant little grow pods. Those lamb chop or lamb quarters are in there. And I've got, I'd say, about 15 of them that are viable. I use my, I have carrots that I use around the perimeter of my garden bed. And it helps cut out the weeds. And the carrots are starting to come in. And my other crop on the other side of the my raised garden beds are the lima beans. Not as many lima beans came in as I thought, but it's still, they're still growing, and I'll get something out of it. And this is my first year doing ginger. Okay, it's not a girl, it's a ginger, and I don't know. I don't know what the hell's going on with the ginger. This is my first year doing it. If I succeed, I succeed. If I fail, I fail. Either way, obviously it's an underground plant, so I can't really see anything until some greenery starts popping up. And it's a slow growing plant, is what I've been told. And I'm not 100%. It grows in Asia where it's cool. And I live in Northwest Indiana where it's cool. So I don't see why it would be different geographically, why it wouldn't grow. So let's talk about gun talk now. When you do live streams, okay, you can't show guns, okay? So I made sure that all my freedom sticks and freedom seeds are out of the way. So I have an AR-10 lower, a freestanding AR-10 lower that I'm considering options. Do I want a AR-10 308 bolt action or a semi-automatic 308? And the reason why I just want to stick with 308 and not 6.5 Creedmoor or some other caliber is because if they use the same magazine and I'm tired, something bad could happen when you try to shoot a bullet through a barrel that wasn't made to shoot. So what happened was when I was buying my AR-30 upper, I incorrectly purchased the wrong lower. I did not know that it needed a 300 Win Mag lower from Bear Creek Arsenal. So I went ahead and kept the purchase because you can always do something with your AR-10 lower. So just for the folks that aren't gun people, and the two main components of a semi-automatic rifle nowadays is the upper, and that's where the barrel is, and the lower. And the lower is where the trigger assembly is. And the trigger assembly and all that part of that lower is the controlled item that you have to do a background check on. So what I did is when I went to my gun store to pick it up, because the manufacturer will send it to a local gun store and you do the background check and you've got to pay for that. That's okay. So I have two pieces that I'm waiting on. Also, I'm still waiting on to get my AR 300. I should call it my LR 300 now. Win Mag, a bolt action carrier group replaced. The one that it came with was not working functionally. So I'm still waiting on that. So, I work as a nurse practitioner. I work in the medical field, and I like to incorporate medical talk. Okay. So, having said that, we're going to get started. Just taking a look to see if anybody's chatting. I don't know. Nobody's chatting anything up. It's not. So, migraine headaches, okay? They're more than just headaches. For many, they're a deeply debilitating neurological condition that impacts your daily life. Whether you've experienced migraines yourself or are trying to understand them better, this guide, this talk will help make you understand migraines better. Signs, symptoms, treatments, including naturopathic options that may provide relief. Now, you got to understand, folks, I took a 2-year naturopathic integrative medicine fellowship through George Washington University. So, yeah, I like to go over medical treatment and stuff, stuff I can prescribe. And I also like to articulate the naturopathics. And everyone's got an opinion, just like an asshole. I got mine. This is what I think. Migraines are a headache that typically causes moderate to severe throbbing pain on one side of the head, but they can also include a host of symptoms, and it causes your ability to function to deteriorate. It can last from a couple hours to a couple of days. It's pretty debilitating. There's several types, with the two being a migraine with an aura, which is considered a classic migraine, and a migraine without an aura. The migraine with the aura, what happens is you have visual changes or tingling sensations before the migraine headache comes about. Obviously, the migraine without the aura is more common and lacks these pre-symptoms, but it still causes pretty intense headache, pain, and other symptoms. Other types include chronic migraines that happen or 50 more times a month. There could be menstrual migraines, uh, vestibular migraines, which involve dizziness. But we don't really understand the cause of migraines 100%. And when we say that, we always go back to it's a combination of genetic, neurological, and environmental factors, all three that play a role. Some common triggers include hormonal changes with women, the estrogen around menstrual cycles. Stress plays a big factor. Foods like aged cheese, I don't like cheese anyway, caffeine, alcohol, and artificial sweeteners may cause migraines in some individuals and On the other hand, caffeine can help treat the migraines in some people. Sleep disturbances, both too little and too much sleep, can help. Okay, excuse me. Okay, let's adjust this. Make a quick adjustment here. Bring that up on this side. No, put it down. There we go. I have a little issue here. Can you see where my hand is there? Can you bring that up? Yeah, the other way up. More. See how it's fixed. I'm having some issues here. I think we're going to get it going. Looks okay. My video's a little delayed, I guess. Hey, can you see my hand? It's always a foo bar. So, looks good. All right, thanks, director. Hey, excuse me, director. Can you please grab me a nice, juicy little, one of those carbonated waters, please? That's my director, calming my wife. Thank you. Correcting my. Oh, you have to turn that light back on, please, director. Proper lighting. Anyway, my camera went down a little bit, and you were just talking to the ceiling, like that song from the '80s. Anyway, sleep disturbances. Sleeping too much and too little can contribute to migraines. Okay, bright lights, strong smells, loud noises, and weather changes can serve as triggers. Now, what I encounter the most are patients complain of the lights. We call this photophobia. The smells and the loud noises, not so much. And the weather changes is usually related to allergies. Now, being dehydrated is a common trigger that's overlooked. And how's my sound check? Is my sound check coming in okay? Okay. So I'm going to do a quick 1-2 here and have a sip. So if you ever had a migraine, you can know that some of these symptoms are debilitating. Other symptoms include a throb, pulsating pain on one side of the head. We talk about sensitivity to sound or smells. What's bad is nausea or vomiting, which can accompany other episodes. Feeling fatigue or lethargic, both before and after a migraine attack. Flashing lights, zigzag lines, or temporary vision loss. These are common with aura migraine. Or is when you have these symptoms happen before you get the migraine. And I better not spill carbonated water on my laptop. Yeah. Tingling or numbness, often felt in the face or the limbs. There's other reasons why you can have numbness, face or the limbs. Damage to your nerves in your face and neuropathy from a neck injury. There's no permanent cure for migraines, but we're going to go over some of the conventional and life. And after osteopathic or allopathic, naturopathic. Acute treatments include sumatriptan or glutamines or non-steroidals that are taken on the onset. Another medication I like to prescribe my patients are beta blockers. One that seems to work best is the 60 milliliters. Start out with 30, go up to 60, 90 of propranolol once a day. I'm not a big fan of putting antidepressants. Sometimes putting patients on gabapentin or Lyrica helps with the migraines. And I really don't like to put patients on anticonvulsants for migraines. That's my preference. Neurologists may say differently. Lifestyle modifications. Okay, now this is just things that you can do. Have a consistent sleep schedule. Try to reduce the stress levels in your life. Stay hydrated and understand triggers and avoid them. Something a neurologist will do is Botox injections and nerve stimulation therapy for chronic migraine. A little bit about the naturopathic and holistic approaches to migraines. They can provide some relief. There's several options for dietary adjustments. Okay, if you hear me give a talk on anything medical related, I always go back to the brain gut axis. Okay, identify and eliminate trigger foods that can reduce frequency of attacks. Magnesium and riboflavin. These can help prevent migraines. I often prescribe magnesium oxide, but the better of the ones to take is called magnesium glycinate, folks. Buy it at the store. It works better than mag oxide, but I have what I have to prescribe. These nutrients are effective in preventing migraines, according to some studies. The magnesium is also good as a smooth muscle relaxer for muscle tension. Foods like leafy greens, bananas, and nuts are rich in magnesium. You want to eat anti-inflammatory foods, okay? That's one reason why I'm growing ginger. You can incorporate turmeric, ginger, salmon, or walnuts, and they support overall health. There are some herbal remedies, okay? Something called feverfew and butterbur are help to reduce migraine frequency. So if you watched a couple videos before, I talked about butterbur as one of the natural treatments for allergies. So it has multiple uses. And the thing is that, we always say consult a healthcare provider before trying these. But if your healthcare provider knows nothing about naturopathics, and they're going to tell you not to take it, okay? They want you to take what they prescribe because they know more than you, which they might. But do your research and do your research. Just don't read one article. Stay hydrated. Um, Dehydration is a common trigger for headaches. And now I'm going to go back in time, circus 1990. Okay. I was earning my expert field medical badge in late summer, early fall, right before we went to the Middle East in the 75th Rangers. I was on the 160th. 12-mile road march. Night before, I did not hydrate properly. I ate pizza and Coca-Cola for a 12-mile road march. Needless to say, with all the salt and that, and not hydrating myself properly, I got dehydrated. I got a hell of a migraine headache after that. Of course, I passed out and I required some fluid resuscitation, but I did pass. I started down quick. When your body lacks sufficient water, it can affect your brain and fluid balance and lead to discomfort. Well, the discomfort that happened to me is as soon as I finished that crossing, finished the finish line, I fell into the dirt on the ground, and I was out. How you can sleep with your rucksack like right there? I didn't even get to do that. I was just plumped over. So, we say to drink between 8 and 10 glasses of water a day. When you feel a headache coming on, sip water slowly. Add some electrolytes if you're feeling particularly dehydrated. We're going to go back in time again. Circus 1992, Sears School. Anytime that we had to bring for water at Sears School, JFK School, it's an Army survival school. They put a drop of salt and a drop of sugar in the water to keep us hydrated. because if you don't have that, your body can't absorb the water properly. It's about the osmolarity level of the fluid, and you're not gonna get stuck with an IV. So, if you're really feeling dehydrated in the summertime, just a pinch of sugar, pinch of salt, and drive on. Keep on keeping on. Essential oils, okay? This is just my opinion, but, oils like lavender and peppermint have soothing anti-inflammatory properties. Peppermint oil relaxes the muscles, while lavender helps calm the mind. Out of the 2, I prefer lavender oil, and I'm just doing a quick check. Looks like we're doing okay. I had the screen thing facing up. We'll figure something out. Anyway, so you put a few drops of, lavender around your temples here, okay, and deep breathe, and at the same time, practice deep breathing, okay? You wanna breathe from not here, you wanna breathe from here, from below the gut, and get diaphragm working. You wanna expel all that rotten air that you don't usually get out. Deep breathing helps regulate oxygen flow to the brain, reducing tension and headaches. Now, one thing that I like to have is this trainer here, okay? It has some resistance in the breathing that makes you deep breathe, and it takes the diaphragmatic breaths. Willow bark, okay, you can buy this at any stores, but not the one that's called got no glue. It's nature's aspirin. Willow bark contains salicin and it has pain relieving properties. It can be consumed as a tea or a supplement. Of course, if something's hot, you want to put something cold on it. So a cold compress on the back of the neck or the forehead can help alleviate some of the headache symptoms as a last resort. Now, remember earlier we talked about how caffeine can trigger a migraine in some people. Yeah, it can also treat a migraine in some people. In fact, some of the medication we prescribed has a combination of Tylenol and migraine caffeine medicine in it. Or you can drink a cup of straight coffee or some green tea, and it provides some relief by constricting the blood vessels. Of course, you don't want to drink too much. So, other herbals, we talked about ginger and peppermint as a tea, but chamomile tea can be used for migraines. I am a preferential towards ginger. Okay. You want to brew the tea freshly and sip it slowly. Ginger tea is very beneficial for the migraines and for the nausea associated with the migraines. So if you've seen a couple of my videos, I believe in acupressure using the ear, and there's other acupressure points. And we're not going to go to the ear acupressure poster that I have up, but another one you can do is the LI four spot, the area between your thumb and index finger for a few minutes, right here. So this is what you massage for a few minutes, okay? The area between your thumb and your index finger. Now this is your index finger. Go over here, massage it for about 5 minutes each. It helps your migraine. It's you're just using the electrical conduction of your body to help block pain. You don't have to believe it, but it's true. And me just doing that for the 10 seconds did make me want to take a nice deep breath and relax. It does work, folks. Definitely want to practice good sleep hygiene, get a good sleep schedule, avoid screens, okay, before going to bed. Want to practice stress management, mindful techniques. I'm not a big fan of yoga, as you know. I other types of stress management. Acupuncture is good. Acupressure is good at the same time. Instead of if you can't stand the thought of a needle, there's acupressure points. And of course, I talk about auricular acupressure. Now, if you come in to see you come in to see me for a migraine, so the first thing I'm going to do is do a neuro exam on you. I'm going to ask you a history that's going to piss you off because I go deep, and I order a brain MRI to make sure we're not missing something deep. And the visit starts as soon as you walk in the room with me, but don't show up late. Anyway, migraines are complex, but with the right tools and strategies, you can help control them. You want to take control of your migraines by starting with small lifestyle changes. Do what you can that's natural. My next, we preppers, we talk about treating shock, medical, and all this. It's all what it basically turns out to, and all be all. Okay, do I even know how to put a tourniquet on? And half the time, if you don't practice these skills, are perishable, even for a medical professional. So what I want to go over today is called shock. IV bag fluid guides for shock treatment. Okay. So, and I'm going to go over different bags of fluid. Okay. But the two bags that I think are the most important, the two different types of IV fluid are, of course, if you see this, 0.9% sodium chloride, normal saline. This is one bag that you want to keep. Okay. And then we're going to go over the other bags, the different types of fluid, how they work here in a moment. But and you'll see the logic of what I'm saying here in a minute, because more is dangerous. So shock can be a life-threatening condition requiring swift and accurate fluid management. And we're talking shock from blood, hypovolemic shock. Okay, we're going to talk about the primary IV fluids, their uses, and appropriate dosing for managing shock, both in pediatric and grown-ups. Now, I wouldn't expect anybody that doesn't know how much IV fluid to administer to a child because those bags are way too much fluid for them. And what hospitals do now is they'll have that main bag, that 2,000 bag, but they'll have it on a pump, okay, and they'll have it on a reservoir as a backup before it goes into the pump. So there's no way that you can overload the child or the infant. Whereas with a grown up, we just mainline a IV fluid with some tubing and a catheter and make sure you tape it up. Pediatric is a lot different. So understanding shock. Shock occurs when there's inadequate blood flow to the organs and the tissues, leading to oxygen deprivation and potential organ failure. IV fluids are fundamental in stabilizing patients. Their selection and administration should be tailored to the type and severity of shock. So that there's main categories of IV fluid include crystalloids, such as the normal saline, and then lactated ringers. Okay, then there's colloids like albumin or hetastarch. Excuse me. Time for me to take a sip of delicious. Crystalloids are commonly used because their availability and they do expand the extracellular fluid volume quite well. Colloids stay in the vascular system much longer, but they're not first line therapy. So back in the day, back in my military day, okay, we used to pack the combat lifesaver bags with lactated ringers. This is remember going. This is circus 1990 when I first started teaching combat lifesaver as a medic to the non-medical people. Then we went down and we switched it out to saline, normal saline. And a couple years later, the fools decided that they're going to put a bag of head starch in the combat lifesaver bag. And the problem is the Joes, when they were getting drunk, they were popping each other with head starch, not paying attention to what the IV fluid was. And that's not good for someone whose volume depleted from alcohol. So that's why I wanted to make this video, just because it brought back some memories. So the first line treatment, of course, is normal saline, like I showed. It's used for hypovolemic shock, septic shock, and dehydration. Okay, and it's about 30 milliliters per kilogram bolus over an hour, and you adjust it based on clinical response. Now that's a lot of mumble jumble words. Basically, check the blood pressure, check the urine, see what the color of their urine is, see if their blood pressure responds back. And then for pediatrics, okay, it's about 10 kilograms. I'm sorry, 10 milliliters per kilogram bolus over 30 minutes. Monitor the response. Now, hopefully, you'll never have to put an IV in a kid because you got to be careful as hell how much you infuse. You don't want lactated ringers is good for shock. It's also good for burn patients and trauma patients for balance for fluid resuscitation. With lactated ringers, it's the same dose, 20 milliliters per kilogram for an adult over 60 minutes, and then 10 milliliters per kilogram over uh, 30 minutes to an hour. Now, 10 mLs is a 10 cc syringe, okay? So, and you have to learn how to switch from pounds to kilograms. In fact, I don't even, when I look at somebody's weight, they weigh them in pounds, but I really just care about what's their weight in kilograms. Divide that by 2.2. Okay, it's the trying to convert uh, Celsius and Fahrenheit is the equation that messes me up in the head. It's not a direct conversion. Now, if you're a prepper, I don't ever want you using dextrose 5% in water. It's used for hypoglycemia in addition to dehydration, but it's not first line for shock because you only want to give it if there's electrolyte imbalances. And then human albumin, 5% colloid, hypovolemia with burns and septic shock. No, I don't even keep any of that. And then there's hypertonic solutions like 3% sodium chloride. Now, you notice how I said normal saline, which is 0.9%. Okay. Hypertonic solution means there's a lot of more thickness or osmolarity in the fluid than there is in the human body. Normal saline means that the thickness is equivalent to what your bloodstream is for the most part. So hypertonic solutions, thick solutions, are good for brain injuries, okay, traumatic brain injuries, because it reduces the swelling, the intracranial pressure. Severe hyponatremia with shock. Hyponatremia means the potassium level is really low. So if the potassium level is really low, you're going to want to go with a hypertonic saline solution. Of course, you worry about fluid overload, pulmonary edema, the blood pressure skyrocketing. And if the veins in the neck start getting distended, those are with all IV fluids. You want to monitor for that. You never just put an IV in somebody and not keep an eye on them. IV fluids are, they're supportive therapy. You have to address the underlying cause, whether it be infection, trauma, or cardiac issue. You want to use the balanced solutions when possible. Okay, lactated ringers reduces the risk of acidosis. If you're not a pediatrician or you don't work in pediatrics, maybe not a good idea to stick with anything other than normal saline or lactated ringers. So now we're going to do a little switcheroo, and I'm afraid to do this because I'm going to move my camera. I'm going to bring my phone, and we're going to go over some gear. Okay. I have it all laid out, but we're going to go over here. So, excuse me, I'm going to just do a little switcheroo here.